I'm here with my good friend Dominic. How are you?
I'm good, Mike.
Good. So, Dominic has been one of my very, very good friends for at least 10 years.
At least.
Yeah.
At least.
And he understands me in a way that a lot of people don't because we share a lot of the similar stressors in life.
Well, being a surgeon is not just about the surgery. And sometimes you need to lean on each other. We travel all around the world together. We teach surgery. We have surgeons fly into our practices. And here I am.
Yeah. So there are honestly a handful, and by handful I mean 4 or 5 fingers worth of people in the world that I think are kind of not to be immodest, in the top tier, I think, of facelift surgeons. But Dominic is in that tier. And so, Dominic, what made you kind of go, okay, I'm gonna venture into the facelift E side, from the facelift or side,
the other side of the table. You know what? It's really interesting. Every day we hear people talking about facelifts or how they don't like how they look, and it can be an insidious. Sometimes it could be vanity. Sometimes it could be not recognizing themselves. This was not on my radar 1 year ago. It was professionally, and I answered questions every day. A year ago, I had no concerns with how I looked. And then there were 3 events this year, 2 of which you were at, that actually made me consider moving to the other side. So the first was in Milan, Italy. You remember that conference?
I do. We had teaching facelift together.
Teaching facelifts. We had all our friends there, and there I was at the podium. Big white light in the back. You couldn't see anybody, but there was this floor-to-ceiling screen. And as I spoke, there was this old guy on the screen. And I looked at it and I thought, that's really weird. They're playing another speaker whilst I'm speaking. Oh, I'll carry on. And then I looked and the old guy was wearing my jacket. and I thought, this is just uncanny. And then it took me a while to realize, but it was actually me speaking. So that was my first foray into, the perception I have of myself is a little bit different to what the camera picks up. And I thought, it doesn't matter, we'll go with it. The second time was Cairo, Egypt. You remember that one? We both did live surgery, and I think you, Joni, and Megan, and I, and Avani had a drink before I went to the gala dinner. And I had to put on a tux, which I haven't worn in forever.
I skipped the gala dinner.
Mike did. I think Mike went riding camels instead. Instead of camels, I rode the Uber. The crazy Cairo Ubers, where it's more like scratch the car all the way. But as I did up my little dicky bow, and I sat there bouncing around, there was literally a party going on between my neck and my dicky bow. And I'm like, this is just hot. This is new.
Yeah.
I'm like, okay, obviously the neck has gone. I'll forget about it. And then the third thing happened. I went skiing a couple of weeks later, and I trapped my neck in the buckle of my ski helmet. And it was at that point I thought, right, it's time for me to become a patient.
Well, I told you that reminds me of our good friend Brad, who zipped himself up in the windbreaker, and he said that was it.
Yeah,
it was like this.
It was definitely the final nail in the coffin.
Yeah.
Yeah.
So, switching from the surgeon to patient side, we have patients every day that have done their research and have read everything about every technique, and it can be easy for us to be like, yeah, you don't know what you're talking about because you've read all this stuff and you put it all together and synthesized it and chatted it and went to all the different discussion boards and rooms, and you feel like you know what you're saying. You know everything about this. Patients often are very accepting of just whatever you think, just do it. And often they want to manage little decisions. Speaking with you in these last few weeks, months, you have been the very opposite of that. Tell me about that.
It goes down to insight and trust, right? The worst, we're surgeons, number one, we're creators, and we work on tissues, but also we appreciate aesthetic proportion. We don't need to really examine a face to know what the face needs. We will know within 3 seconds of looking at someone the rough procedures we're planning to do. When a patient arrives and says, well, I don't want that and I'd rather have that, that interferes with the process. When you choose a surgeon, you're choosing the predictability of their outcomes, and you're choosing a safe, competent partner to go on that journey with. When the patient arrives with preset either misconceptions or desires that are going to compromise that ultimate outcome, I don't think it adds anything to the process. So when you said, what would you like? I said, do what you want.
So,
You know, what I want you to do is get yourself into that right brain space where you're operating. Now, when we're operating, we don't make decisions when we're operating. The tissues will tell us what needs doing. And that only comes with decades of experience. So that's why I said, I'm not going to muddle this, Mike. You make the decisions.
It's interesting. So that from the aesthetic standpoint, but even from a technical standpoint, as I said, Dominic, I think, is in that same handful of, at the moment, probably the cream. Yet we don't do everything exactly the same way. We have co-evolved a lot in the last few years, but there are still certain things that we don't do exactly the same way. Some of the side dishes we cook, the main course we do very, very similarly.
We do.
But what's interesting is what I do because it works the best for me, having tried it all. And the edges where you are out of where the overlap, where the Venn diagram doesn't overlap, you do those because they work the best for you, right? What's very interesting is it would be easy for either one of us for you to say to me, listen, I've done all this stuff. This edge of the Venn diagram works. But I think, I could try that, but it wouldn't work for me because our circles largely overlap, but they don't entirely.
Surgery is a learning curve that you never peak at. You can get to the point of consistency, competency, and expertise, but that's through repetition. And the surgeon has to be comfortable operating on the patient in the way that they are happy operating.
So the thing that we both want, and is in common with our civilian patients, we all just want the best result with the least problems. That's what the patient wants. That's what the doctor wants. That's what the doctor wants when they're the patient. You want the best result with the least problems. Well, anyway, thank you for your trust. Thank you for letting people follow along. I think it'll be educational for us. Probably you're going to get most out of it, but also through your eyes as well.
This has certainly paid back to all of my previous patients. I'm going through it. And when I say what it feels like, I'm going to know.
Yeah. All right. Love you, brother.
All right, you too, bud.
We are day one with Dr. Dom after surgery. How are you?
I'm great, Mike. I mean, we've all seen your videos. Everyone says they're great. This is not my experience with day one patients, but I do feel good. I feel really good.
Well, good.
Slept well. The only issue I've had is tight, which one expects with surgery. I've had a little corneal abrasion overnight, which is like a little scratch in the eye. It's healed. It took 12 hours. It's better, completely better. Other than that, this is good.
Yeah. So corneal abrasion, for the first off, Dom is 50. Yesterday we did for him a deep neck lift, deep plane facelift, including some of his special touches that he taught me on the deep plication. More to come on that.
Yeah.
Lower blepharoplasty, upper blepharoplasty, brow lift, a little bit of laser resurfacing, just a sprinkle of fat transfer, buccal fat reduction. And then corneal abrasion, for those of you who don't know, it's a scratch on the surface of the eyeball. He's downplaying it. It's miserable. Feel like there's sand in your eye or glass in your eye. It's really uncomfortable. It heals spontaneously, usually overnight. We try to prevent it with lubrication and a corneal shield during surgery, but sometimes even the insertion or removal of the shield or just the presence of the shield will give you that. So I apologize for that.
It's not your fault. It happens in surgery, and it's self-limiting. 12 hours, gone.
Good.
Yeah.
Other than that, not too headachy, not too much pain down here.
No headache. I mean, it's restrictive, it's tight, all the things that, what's fascinating about this process is we talk to patients all the time about, what it's like. And I'm feeling it right now. So it's tight, it's restrictive, it's uncomfortable. The other thing that the guys may not notice, I've got these little stitches in the eyes. These are unusual. They're called tarsorrhaphy stitches, and they sometimes, if the lower eyelid's been a little bit baggy, well, Mike, you should be educating here, but if the lower eyelid's been a little bit retractive or there's some swelling of the eyeball, we put these little stitches in. So that's kind of a minor annoyance that I've lost my peripheral field temporarily.
Yeah.
But it's good.
It's kind of holding the lower lid up on the outer corners. We'll leave it there for a few days and let go of it. But it does give you kind of a little bit of a visor effect, but it helps prevent significant kind of jelly-like swelling of the coverings of the eye and or from the weight of the swelling pulling down of the eye while it heals. So there are various forms of lower lid support. This is the least invasive, kind of a temporary one, but it was a good idea. So.
Yeah, no, it's good. It's everything I expected. It's slightly tight, slightly uncomfortable, not painful, nothing that even simple analgesia will fix. Yeah, that's great. I appreciate you.
You're
Thank you.
welcome.
Thank you for doing this.
You're quite welcome. All right, we're day 2 with Dom. How are you doing?
I'm good, Mike.
Good.
Yeah, I'm good.
So yesterday, the corneal abrasion was kind of your bad situation. Has that improved a little bit?
Yeah, that was annoying, but
That
it's
was
better.
fine.
It's 12 hours gone.
Yeah.
How am I today? Everything that's expected. It's tight. It's a little uncomfortable. I slept great. The nursing care is fantastic. The little tarsorrhaphy stitches are probably the only thing that's bugging me a little bit, but they're coming out tomorrow.
Yeah. So again, we did a deep neck lift, deep plane facelift, lower and upper blepharoplasty brow lift, a little bit of a lower lid laser, little sprinkle of fat transfer. And as a result of the lower lid and laser, I was concerned a little bit that in the healing process, the weight may pull his lower lids down and be uncomfortable and increase swelling. So we're just doing a couple days of this really annoying suture, short-term misery to prevent medium-term real frustration.
Absolutely.
Yeah.
Definitely worth having them. And because I know what they're for, it makes it very easy to have them there. Everything's as expected. It's interesting. You take 1,000 people through a facelift and you hear all these things, but to feel it yourself, it's exactly everything you think it would be. It's tight here, the ears are numb, but it's a mental game. It's more a mental game than a physical game, but it's very, very doable.
So that was he had 2 epiphanies this morning. I thought that was one, but it's more of a mental recovery than physical. But then 2, like all men and any woman that's bleeding excessively, I put a net in Dr. Bray. We took it out today, and tell us about that epiphany.
Absolutely no change when it came out. It still felt like the net was in.
Yeah. So there was no difference in feeling to you with or without the net.
No feeling with or without the net. No.
So one of the things we said is that doesn't make us feel as bad then if there's a patient that's bleeding during the case, or for me, every male, I kind of used to feel guilty about putting the net in, but apparently it doesn't change comfort at all to have it there.
Really doesn't. It feels exactly the same with or without. So I don't think there's any problem having it in, put it that way.
That might be epiphany of the day for me.
Yeah. Interesting.
Well, thank you for letting them see how you're doing on day 2.
Absolute
Greatly
pleasure.
appreciate it. Yeah.
Thank you, Mike.
You look great. Happy.
You too, Mike. Thank you.
You're welcome. We're here day 5 with Dr. Don. How you doing?
I couldn't be better.
Yeah.
Yeah, felt great. Felt really great.
So I understand. So just as a recap, deep neck lift, deep plane facelift, preservation style, which he and I actually helped create. Lower and upper blepharoplasty brow lift, and only lower lid laser resurfacing. Tiny bit of fat transfer. So I understand you slacked last night.
Not too much surgery.
Not too much surgery.
Not too much. It's just that's about everything.
Yeah.
Yeah, I slept like a baby last night. First night, literally slept through. Didn't need any pain meds. Have 0 pain. Haven't really had any pain at all. First day with the tarsorrhaphy stitches that keep the eyes together. That was a little uncomfortable, but not painful.
Yeah.
Yeah, slept like a baby last night. Feel great. Loads of energy. Actually, I'm trying to stop myself doing too much. I've got lots of plans, but I'm actively trying to stop myself doing things.
I'm sure you find yourself counseling the patients that are looking too good or feeling too good. Now listen, you still have surgery.
It's big surgery.
Yeah.
But it's still deceptive.
And so I actually worry sometimes about the ones that are doing great, because you feel like they're going to forget where they are. Only day 5 that error and everything lift. Not to, but the average person, they're doing laundry, they're walking the dog, they just, they almost feel guilty that they're not doing stuff. Whereas I think, taking the time to rest is important.
You've got to take the time to rest. It is big surgery. And you're reminded if you overdo it. I think chewing or eating straight afterwards, it feels a kind of tight here. It literally feels like you've got a couple of surfboards slapped on the side of your face.
Yeah.
And you're walking around with surfboards on there. Now, I'll often hear for patients, it feels like a sling or it feels completely numb. I would describe it as just sort of heaviness on the sides of the face. Once you eat and also you're masticating hard, it becomes very tender. But little ice pack on there, stop eating. A couple of minutes later, it feels absolutely fine.
So interestingly, you were telling me a minute ago about different things that we're just used to telling patients ice and use the vinegar soaks on the peeling area, which I think you're done, by the way. I think you're peeled entirely.
Peeled off.
Which of those interventions, sleeping on your back, from being the surgeon and now also the patient, which of those interventions, the icing, the vinegar soaks, the Aquaphor, the positioning, do you feel any of them were particularly helpful, or do you feel some of them? I'm just curious from
From both sides.
Yeah, from both sides, I would say I've been surprised how comforting the vinegar soaks are. They're great. Really cools everything down. And then putting that barrier cream, that aquaphor on afterwards, it just feels great. So laser recovery is actually very easy. If you take some little gauze swabs, you put a bowl in the fridge, you have some iced vinegar water in there. That cooling ice water on there really helps hydrate and desiccate. And then you put the aquaphor on. Position wise, the other thing that I've really liked is the little straps with the cold packs in. I'm not a great fan of bags of peas. They're just
You on the internet now?
I mean, if anyone wants some peas, I have about 38 bags.
Yeah.
And they're going free. Come and pick them up. I haven't really used peas. I like these little straps. They help just to put on here and submentally. Positions wise, sleeping on your back is annoying.
Yeah.
I'll be honest, I haven't been completely flat. I've had a couple of pillows, but I've slept just great.
Good. One of the things that you're mentioning, I said, we got to get this, you saying it live, is obviously you feel swollen, you feel like you have surfboards on the side, but you also described you have relief of some sensations that brought you to surgery in the first.
Yeah, it's amazing, and it's something that I hadn't thought of. Now I look back, I noticed it. So there were times, you know how hard we work. We don't stop. Evenings, weekends, travel. Half the time, when I was feeling happy and thought I was smiling, I could feel this weight down in the bottom of my face. And you can almost feel that mid-face hollowing, and you know that you look tired. People say, are you tired? You're not tired. I'm fairly high energy, as you can probably tell. But people say, are you tired? Having everything lifted just feels better. It feels like it's in the right place. It feels like it's less effort to smile. That if your face is just in its recumbent repose, it looks as it should do. So that's something I wasn't expecting. I'd do it again.
Well, yeah.
Hopefully not for many years.
We are at day 7 with Dr. Dominic Bray. How are you, Marco?
It was better when we had 10 centimeters between us.
Well, good. Day 7. This is all practically the end of the clinical part of the series.
It's so sad.
I know.
Then we go back to being friends.
Let's go back to being friends. So Dom is making this look way too easy. 7 days ago, we did a deep neck lift, deep plane facelift, upper and lower blepharoplasty, brow lift, isolated lower lip resurfacing, bubble fat removal, a tiny bit of fat contour.
Yeah.
So one of the questions I know I'm going to get is you are recovering honestly much faster than the average person, which just men honestly typically heal faster, I think. Higher blood supplies, they make them terrible to operate on. They bleed a lot during surgery. The surgery is slower and more stressful, but the recovery, interestingly, is often faster. You're healing fast for a man. Any insights? Because people are going to go, what's the secret? What? Yeah.
I agree with all of that. Men are a real pig to operate on. Strong ligaments, great blood supply. That's also why we do tend to heal quicker. What I have found is that every part of the process is exactly what I expected it to be. And I'm lucky. Outside into the process, I know what to expect. And actually, I've enjoyed those feelings. When it feels a little bit swollen, I know why it's swollen. If I'm doing something and something feels a little bit strange, I know why that's fitting that way. So there's no stress, cortisol, worry, because this is just part of the process. And we tell our patients the whole time just to trust the process, and this is normal and this is expected. And patients are always looking at you for, that chink of, maybe I'm not the one that this is all. You literally just have to trust the process. So I'll give you an example. If you look back at the day 1 video when I had the veal corneal abrasion, they're horrible.
They were down laying.
They hurt. But actually, and this is going to sound really weird, I enjoyed the corneal abrasion. But why? I lay there first night in the bed, light hurt, and my eye was watering. But I knew that it was a corneal abrasion, and in 12 hours it would be gone. And so as I sat there feeling the corneal abrasion, I thought, how good is this going to feel in 12 hours? It's uncomfortable now, but in 12 hours it's going to be gone. And I felt amazing knowing the pain would be gone. So that little story, I think with positive mental attitude, getting through the surgery is so much easier. You don't sweat the small stuff, and even the little side roads that aren't great. You just know they're going to be fine. You trust the process. It actually becomes very easy. So, I think mental preparation, pre-education, listening to your surgeon beforehand. A lot of patients, we deliver a lot of information before. There's a saying that you've seen on lectures I put up all the time: education comes before, excuses come after.
Right.
Right. And it's very easy for us to feel we've imparted that information beforehand, but patients really aren't listening beforehand. They're stressed, they're nervous, they're excited for the surgery, but they're not really listening to the word. So I think if you're preparing as a patient for this procedure, really listen. When the surgeon says, this is going to be uncomfortable for a few days, this is going to be swollen, and you really internalize and think about that, when you are uncomfortable and swollen, there should be no surprises. It's normal. It's part of the process.
Yeah. Well, I think it's easier for you to remain calm because you've seen how many thousand, right? When it's the average person, it's the first one they've ever seen, and it's on them.
I totally get it.
Yeah.
I totally get it. We've climbed this mountain, thousands of times, but we're taking that person up the mountain,
Yeah,
and getting them down again.
Well, anyway, no one I'd rather climb it. No one I'd rather climb than you.
Climber.
End of the 7th day, and you are now no longer my patient,
Am I discharged?
but still my colleague and my friend.
Well, it's been a great journey, Mike. To be your patient, I'll always be your friend, but to be your patient for a week has been an absolute privilege. It's been an honor. I can't thank you. Surgery is the surgeon, and it's meeting expectations and having patients leave a little bit happier. But it's not just the surgeon; it's the whole team. It's the facility. It's the ancillary staff. It's the OR staff. And honestly, my experience here has been fantastic.
Thank you.
Absolutely fantastic.
So it's not unusual. Plastic surgeons have had surgery before, but I think what's unusual is your degree of transparency about it, and your degree of openness about it. Because you're an innate educator. We're both. I think both of us could safely say if we weren't doctors, we'd be teachers.
Yeah.
Right. And so the education that you're providing through this, I think, is spectacular. And even though doctors have had surgery before, none of it applies to what is happening in surgery now. A video, if the two of us had done this video 10 years ago, it would be obsolete because surgery is so different.
Even 6 months ago, it would be obsolete. The field is changing at pace. But to have two guys who are so-called thought leaders within facelift surgery at the moment come together as doctor and patient and go through this is a fairly unique thing.
Yeah. And I think it's going to make my process better, interestingly. So I just had a meeting with our aftercare nurses. They don't technically work for us. We bring them into a service. And I just had 15 of them there. And we made, based on your feedback, having gone through it, it's not that we don't listen to our patients when they tell us I liked this or I didn't like this. A lot of what we do now in our current instructions is informed by things that our patients have told us. But it is in some ways even more impactful when tell us about the chewing and the heat that generates, the discomfort.
Yeah, so there are these generic post-operative symptoms that we hear from every single patient. And all doctors are. We're information retainers and repeaters. We repeat patterns and processes. And when you hear it from 100, 200,000, 2,000 people, you then repeat that to your next patient to say, this is not what was expected. But when you're going through something like this, I was really able to delve deep into, why am I swollen? What is causing the swelling? What is making this worse? And what was interesting, that I've never heard before described anyway, is it's not just surgical swelling within the skin elevation flap. It's actually any movement of the face. So lots of talking, lots of eating, chewing, actually brings blood flow to the master muscles here. And that creates heat, and that heat transfers, and that feels like swelling, and it becomes uncomfortable. So that's something that I've learned from this process. Much like if you were to run a marathon, your legs are going to have heat within them, and they're going to be sore afterwards.
Yeah.
And I think to educate patients that everything they're feeling is basically the body's way of healing itself. And if we can harness those symptoms and reduce them, then at least we can educate people to have an easier recovery.
Yeah, well, I think so. Cooling, one of the things that you have really impacted me with is the importance of cooling. I mean,
the ice bottles, which you have not seen these yet, but I'm doubling down on these ice bottles. Maybe I'll put a picture of the ice bottle up here as we speak.
Yeah, they're great.
But the ice bottle, the vinegar soaks, we use these vinegar soaks. You guys have heard me talk about this before. We use them for anti-infective purposes, but you're saying they're soothing.
Well, they're heat dispersed.
Yeah, back to the cooling.
Back to the cooling. Cooling is absolutely everything. The more heat you can disperse, the more inflammation you can take out, the more comfortable it becomes.
Yeah, well, it's interesting. Oh, one thing I'll mention. Even though Dom's an accomplished facelift surgeon, we still treat doctors like patients, right? I say, pretend you're a plumber. If you're a surgeon, you see one of us or anybody else, you should never be embarrassed to ask something, whatever, and think, oh, I look foolish by asking this. I should know this. Like when you're again, we open this video, friend for life, patient for a week, right?
Correct.
And so in that context, you had to say there's no egos and no embarrassment. You ask what you ask. But the other reason I'm bringing this up is I'm letting him go at a week, which is not. I make everybody stay 10 days. He's actually not leaving till day after tomorrow. He's leaving on day 9. Technically, this is just the last time we have time to do a video.
I'm going back to my own team, my own hospital.
Yes.
So that's safe. It's controlled.
Right. And a team of facelift people.
Yeah.
So, and actually, he's not even leaving until day 9. So I just want to put that out there because someone's going to be like, wait a minute, you let him go a week. This is just our last opportunity to be together, and I didn't want to miss that.
Yeah.
It's just so interesting, and the cross international communication now. Surgeons are, especially the hungry ones, who are constantly trying to get things better. And as soon as someone makes an advance, we have all these back channel chats. It's around the world a minute. Yeah. I think that's been the two things that have pushed plastic surgery, or was facelift surgery, the hardest and the fastest in these last few years, is the instant communication. You no longer have to wait for a national meeting to come up and then maybe catch the presentation, maybe not, and then maybe get to talk to a guy in the hallway after, and maybe not. It's immediate.
Yep.
And social media, I think, have pushed results harder than anything else.
Absolutely agree with that. Techniques go viral very, very quickly through WhatsApp, back channels, Telegram, Instagram, places like that. Social media. You and I are co-editing a journal in facial plastic surgery next year. And the co-editorial is on social media, isn't it? The good, the bad, the ugly of social media.
Yeah. Social
media can be used as a force for good to educate. It can also be a deception tool as well. So we almost need to get both sides of social media.
Well, and I'm saying I think it pushes results harder because, and I know you've seen things, I've seen that you see a patient result and you go, that's beautiful.
Yeah.
And the standards are just becoming higher and higher, and the expectations are becoming higher and higher. And again, I think that makes us have to do better. It makes us want to do better. It makes us see possibilities that we didn't know about.
Yeah.
And it's communication and, interestingly, social. I think those are the two things have been more push things further than any new device or any new drug or any.
I'd add one other thing to that, and that is collegiality and collaboration. Probably 10 years ago, it was very disparate. It was quite contentious at meetings. People would gatekeep their techniques. Because there's our generation of facelift surgeons, are all good friends, and are all thought leaders and are sharing ideas, that is really raising the bar very, very quickly. So I think collaboration is key in that.
Yeah. Then I feel like this is the era. Certainly looking back, I think there's never been an era where facelift surgery has been as good and it's fun and as gratifying for patient and doctor.
Yep.
And, I hope I never live to see it. You never know. In 5, 10, 15 years, we'll maybe all enlightened and self-aware and not care about facelifts anymore. Like, I feel like we are in the golden moment of facelift.
Or replaced by A.
Or replaced by A. Yeah. Or the device that finally works and can lift your neck.
It's certainly a golden age of facelift surgery. Right? I would absolutely agree with that. And outcome measurements are different as well. 15 years ago, if someone had a slightly tidier jawline or neckline, that was a good result.
Yeah.
What the ears are like doesn't really matter. What the midface is doing doesn't really matter. These days, we're looking at subtle nuances of topography, shape, contour, depths we haven't looked at. We're operating in areas that used to be deemed illegal to go into. But no, it's a good time.
Well, good. Well, thank you for doing this. I've learned a ton.
Likewise.
It's been a ton of fun, and like I said, you're discharged.
Oh,
You're on your own. See you
Well,
in a little.
I'll see you around the world.
Yeah.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.